We have a new study out that is telling us that 4 out of every 10 Americans are delaying their medical care because of the cost, because they don't have the money. We spend hundreds of billions of dollars at the drop of the hat in a foreign nation to wage a proxy war. We give trillions of dollars of subsidies to corporations over the years, billions of dollars in contracts, billions of dollars of subsidies. But you know what we don't do? We don't give our citizens health care. Every other major country on this planet gives their citizens health care. Now, one of the big things I always hear is government health care means you have to wait. You have to wait. There's waiting lists, so then you have to wait. First off, try to make an appointment in this country right now with our capitalist healthcare. You have to wait. It's called making an appointment, and you have to wait. The only time you don't have to wait is when you go into an ER with a gunshot wound and they put you to the front. It's called triage. That's what they do in any hospital around the world. The person who needs medical attention immediately will get seen first. The person who needs reconstructive surgery on their knee might have to wait, right? So in other countries, you wait based on need. If there's a certain amount of knee specialists in the country and people need the knees done, it's going to take a couple of months, which it does in this country already. But the major difference is, in those other countries, what are you going to pay as a copay? $1? $5? Nothing? In this country, what are you going to pay? $1 bajillion? $1 trillion? You're going to go bankrupt. In France, you might have to wait a couple of weeks to get your knee done, or a couple of months to get your knee done, right? But it'll cost you $0. If you have a heart attack, you're going straight to the hospital and it'll cost you $0. In America, 4 out of every 10 people who need to see the doctor don't go and see them because they don't have enough money. So those people are waiting until they save enough money to go see a doctor. Talk about waiting. And then when they do have enough money, they have to make an appointment, and then they have to wait to go see that doctor anyway. And then they have to bankrupt themselves to hopefully get a treatment. So either way, you're going to wait. The only difference is in America, you get bent over a barrel and fucked in your ass. And they take your whole fucking life savings and then more. And you'll probably still die anyway because we're paying twice as much, 3 times as much as comparable countries. And we're getting worse results, by the way. We don't have the best healthcare system in the world. I don't know who keeps telling you that. Stop believing it. Just use your own personal experience. Think about how many times, if you do have insurance, you have to argue with your insurer to get the procedure or the medication or whatever it is your doctor prescribed or recommended for you. Some random person in an office, in a cubicle, denying you medical care because they have a profit motive to seek and they need to make profits. That's our country. Other countries, you might have to wait a couple weeks when you get your knee redone, but it's free. And if you have an emergency, you go to the doctor right away, and it's free. It's not a scam. These aren't, you're going to hear about death panels, this, that, and what do you call it when your insurer is telling you, no, I don't cover that? That's a death panel, dummy.
What's the matter? The CIA got you pushing too many pencils? Huh?